My name is Lenore MacAdam, and I work at Deloitte Canada. I've had a number of roles in our firm, focused mainly in HR, diversity, inclusion, as well as management consulting, of course. But since February of this year, I've had the pleasure of working in a very specific and new role to our firm called Accessibility Senior Manager, and I'm focused entirely in the area of accessibility. My role was created in part with Deloitte's stated goal of becoming the most accessible professional services firm for people with disabilities in Canada. And it's based upon, of course, our belief, and you're going to hear this a lot this week, as well as today, that we're doing it to become more profitable, more successful, and an organization where people are able to bring their whole selves to work, where people can be who they are and also are able to work to their full potential. So a brief overview of how we got to this point. So Deloitte has always had an interest in inclusion and diversity, but our interest around the space of people with disabilities started more back in the summer of 2012. And that's when our general counsel, Ken Ferdine, was appointed to the chair of a federal government panel, which studied and reported on marketplace opportunities for people with disabilities. The panel was tabled in January of 2013, and it's called Rethinking Disabilities in the Private Sector, and it's received international acclaim. And that really got us going along that line, especially Ken Ferdine, who is again, our general counsel, but now an external advocate. And lucky enough for me, he's now my boss. So in December of last year, Ken was asked to speak at the Harkin Summit, which is, that was the first summit last year. Senator Harkin is the man who started the Americans with Disabilities Act 20 years ago. And so Ken spoke at that opening inaugural conference. I was there again last month, actually. And the message has been simple again, like you've probably heard, hiring people with disabilities is not the right thing to do. We're all starting to see this as a business opportunity and a business imperative. So within early 2017, Ken became our official lead partner, sponsor, and leader for the firm for our firm's accessibility strategy, and he brought me on to work with him, and we started from scratch. So it was an interesting challenge because this was a role that we hadn't had before. And we quickly realized that we had to design it into something that was going to be meaningful and also a little bit more complex than we originally saw. So we've broken it down now into what I'm calling our 3 pillars. One of them is visible disability. The other is the neurodiversity space, which includes people with cognitive disabilities and autism. And then, of course, there's mental health. And it's funny because when we first started with mental health, we thought that, we'll do a little bit of mental health as well, and it's becoming actually one of our main priorities over the last few months. But what's guided us all along is that we want to have a focus on abilities and not disabilities. And that sounds a bit like pablum diversity and inclusion corporate talk, I understand that. But the way we're trying to look at it is we just want our people to be able to uncover all the skills they have, the different skills that they bring, and have that be our leading part of the strategy. So one of the first things that I did, and I don't know how many corporate groups are here, or groups that would have companies that have employee resource groups, but we have a lot of what we call employee resource groups at Deloitte. Some call them business networking groups, affinity groups. We have one for LGBT, we have one for Black professionals, women, and we also have one for people with disabilities that started in around 2014. But it kind of stalled because I don't think that the group was big enough. It didn't have enough of a mandate. So part of my job was to reinvigorate this. And we decided to expand the group's mandate to align with our 3 pillars around mental health and neurodiversity as well. And so far this has gone very well. And like I said before, mental health is becoming a topic that many of our firm members, in fact, I'd say most. I've yet to meet the unicorn at Deloitte who's never had either personal experience with mental health or someone in their very close group. And everyone seems interested in talking about it. So we have done some events. In September, we had an event which seems to have really motivated the entire firm. And so we're a firm of management consultants. 50% of our firm are traveling all the time. We thought, well, what's a great conversation to start is what's the association between mental health and travel, work travel. I mean, it's a perfect storm. You're on your own. You're eating and drinking worse than normal. You're probably sleeping unusually. You're not with your social network. For someone with a mental health issue, and I know this from personal experience, that is not an ideal situation. So we pulled together a panel with some of our executives to do an online webinar, but then after that, we sort of turned the cameras off and had internal conversations in various rooms across the country. And it was amazing. There were tears in the room. There was people talking about their frustrations, and it was getting that conversation going and hearing our leadership speak openly about it was really important, which is then leading us into implementing something called the Psychological Health and Safety Standard. And that's going to be an interesting journey for us, because I don't know if you've heard of the Psychological Health and Safety Standard. It's a set of voluntary guidelines that organizations put together. And it looks at your organization not in terms of how many people do you have who are depressed and how many people do you have who are anxious. It looks at it as, where are the risks? Where are the psychological health and safety risks in your organization that you need to focus on? So the first step to implementing this is a survey that we did with our firm. And at Deloitte, I don't know if any of your firms are like this, but at Deloitte, getting people to take 15, 20 minutes out of their day to do a survey is very difficult. Even if it's something that's mandatory and we send them the threatening emails like, you have to do this, you'll lose your job, we still don't get everyone doing them. So I found I was really nervous about how many people are, oh good, 20 minutes out of my day to talk about my mental health. We had 1,200 people completed on day one, and I think now we're up to about 3,000. So this is really what everyone wants to be talking about. We had so that was our mental health pillar. We also had, at Deloitte, we have something called an Impact Day. And Impact Day is where we give back to the community, and the reality is the giving is a little bit more mutual than that. But we had it used to be, we went out and painted walls and cleaned up, planted trees. But now we're doing more pro bono consulting type jobs. And what we did for Impact Day was we paired up with Ready, Willing, and Able, and asked them, and we did some sessions in Vancouver and Edmonton and Calgary. And Toronto and Montreal, where we talked about how to do sort of an autism 101, but then also how to work together better. We've been out in the marketplace. We've been trying to put some thought pieces together around mental health and around the business case. We are now at the point. Notice what I was talking about just now is about building internal capabilities. Our next stage is now starting to interact with our talent acquisition team to make sure they're clear in all of this. So that they're starting to be, we're building the best talent acquisition team in corporate Canada, we hope. But it's important to align people with the values that they think that they already have, and we're not having a lot of trouble aligning our talent acquisition folks. And I really think, though, that the final piece that I'll get to before I stop is we need to redefine the business case. We need to expand business cases. I do not feel there is one business case. I keep hearing it over and over again. We must understand the business case for hiring people with disabilities. I do not believe there's one. I believe there's many. If you're in a Deloitte environment, it's different than if you're in a Tim Hortons or a Walgreens. If you're in a bank, it's different from if you're in a restaurant. And we're kind of shoving this one business case and then saying the only reason it's not being that it's not working is because of attitudes. And I think people have stopped engaging with the conversation, and I think they've stopped listening and disagreeing, because we're very polite as Canadians. So if there's anything I'd like to get out of the next year in my role, it's to really get a better understanding and a better way of communicating the business case for hiring people with disabilities within different environments. So the lovely gentleman has given me the 1 minute, so I'll give you your minute back. Thank you very much.